So yesterday we talked about CVA, cerebrovascular accident. So we talked about different types, and another one is that is definition of CVA. So these are the things we discussed in yesterday's class. So today we will discuss an important thing. So we will discuss further about cardiovascular accident. So this is very important page you can further refer. Okay, National Library of Medicine. Here they are given very detailed about CVA. So from we will discuss from here. Okay. So here introduction part: stroke or cerebrovascular accident is an acute compromise of the cerebral perfusion or vasculature. Approximately 80% of strokes are ischemic. So already I told you that 80% of strokes are ischemic and rest are hemorrhagic. Okay. In this discussion, we only confined to ischemic strokes. Over the past several decades, the incidence of strokes or mortality is decreasing. Okay. Stroke is leading cause of adult disability worldwide. It is thus critical to recognize stroke early and treat it rapidly to prevent or minimize morbidity and mortality. There are many causes of stroke. Hypertension is the leading cause of ischemic stroke. In the younger population, there are numerous causes of stroke, including clotting disorder, keratoid dissection, and electric drug abuse. In the acute setting, a quick history and examination to be performed. As time is brief, it is very important not to waste any time. As acute stroke management is evolving rapidly, one must consider patient for intravenous tissue plasminogen activator up to 4.5 hours and mechanical thrombectomy for up to 6 hours. The recent Dawn trail showed that one can extend the window for mechanical thrombectomy up to 24 hours in selected cases of large vessel occlusion. occlusion. Okay, so this is the introduction part. So we know that 80%, 85% cases are ischemic stroke and 15% are hemorrhagic stroke. So what are the reason behind ischemic stroke are given here? Hypertension and clotting disorders. Okay, so we have clotting factors in the body, so they are not working properly. Okay, that's the reason our blood is become clotting. Next is carotid artery. Okay, they are the reason behind that, and drug abuse. Okay, so everything, the cause is maybe anything. The causes may be anything, but you have to, whenever the stroke occurs, you have the time limits. So in the allopathy, what they will consider to reduce the risk of stroke, to reduce the morbidity, mortality rate, death rate, and the mobility lifestyle or life modification. So what will they do? They will give intravenous tissue plasminogen activator. So what will they do? They will directly dissolve the clot. Okay. So in 1.5 hours, they have to give this medicine. So some doctors will advise up to 6 hours also, but 4 hours is very maximum. 4.5 hours is the good time to give this remedy, this injection. But here, neurologists will suggest whether this injection is suitable for the person or not. Okay, they are the 60% of prawns and for 30% are cons. So here the positivity and negativity are there. Okay, sometimes mechanical thrombectomy, thrombus, whatever thrombus is formed, so they will release, they will cut down that artery and they will attach the artery directly. So this will done from 6 hours to 24 hours. Okay. Etiology, causes. Ischemic etiology can further be divided into embolic, thrombotic, okay, and lacunar. So wherever the the causes are there, wherever the whatever the causes are there, they are divided into three subdivisions. We have embolic, thrombus, and we have lacunar. In general, the common risk factors of a stroke: hypertension. We know that hypertension, diabetes, smoking, obesity, atrial fibrillation, and drug use. So these are the common. So nowadays, hypertension is common. Nowadays, diabetes is common. Nowadays, smoking is common. Nowadays, obesity is also a common. Atrial fibrillation, it is the overload to the heart. It is also common, and drug use. So here, drug use means whatever the illegals. Okay, that also the reason behind that. But the drugs which are not important to the human body, the doctors, some doctors will prescribe, some are self medication by the people. They will go to the medical hall and they will buy. Okay, they will buy and they will take the medicines. Like mostly in the cold or common viral infection, they will go to that and they will buy the antibiotic and anti allergic remedies, medicines, and they will take it. What will happen for prolonged use? So it is also become a drug. Okay. So without doctor prescription or proper diagnosis, we cannot use those drugs. Okay. So nowadays it's common. That's the reason. Stroke is also a common. For all these risk factors, hypertension is the most common modifiable risk factor for stroke. Okay. So here, very, very important thing. From among those, hypertension is very important. So hypertension is the main cause of stroke. Okay. So can prevent hypertension. Okay. Okay. So here the stroke patient will have more than not less than 140 by 90, not more than 140 by 90. So you need normal hypertension. Sometimes chronic uncontrolled hypertension causes small vessel stroke. So if there is high BP, so you have small arteries in the brain, what will happen? They will rupture, mostly in pons, thalamus, internal capsule, cerebellum, everything. Okay. So what we have to do? We have to do lifestyle modification, weight loss, salt restriction. Okay. Nowadays, salt is very unhealthy. Okay. Because we are using, okay, outside food. Okay. All the uh, food which are using from the outside have salt which are not healthy. They're coming from, we'll call China salt also. Okay, what for the taste to uh to to improve the taste, they will pour some China salt. What will happen? It will stimulate our taste buds. Okay, what will happen if you they will stimulate the taste buds. So what will happen? You eat a lot. You want to eat their food only because of the China salt. So this is very, very dangerous because it will, if you take longer duration, what will happen? The person will have hypertension and will become and will have a stroke. So what we have to use fruits, vegetables, decreasing blood pressure. Every 10 mmg reduction is blood pressure is associated with third reduction of stroke in primary prevention. So first, what we have to risk, if you want to say, any patient want to ask, how should I protect myself from the stroke? Okay, you have to tell them that you have to avoid salt food, you have to avoid weight, you have to avoid the obesity, and you have to reduce the salt. Then one third means 30% less risk you have to get your stroke, and you have to do exercise, everything. One third of adults in USA have elevated low density lipoprotein LDL, very dangerous, very dangerous medication. Oh, sorry, very dangerous lipid. So, so low density lipoprotein lipid fat is very dangerous. So increasing in the LDL may cause stroke. Okay, so this is very important, and cardioembolic stroke also lead to stroke. It will due to the atrial fibrillation, the because of heart is not working properly. Okay, so in that atrial fibrillation, already I told here. Okay, so these are the causes. The lacunar strokes. What are the reason? Mid-cerebral artery. Okay, vertebral basilar artery, latinocholestrial vessels. Okay, these are the areas where you can show the lacunar stroke. Causes is mostly fibrinoid necrosis, hypertension. Okay, so stroke in the most common cause of stroke is hypertension itself. Okay, epidemiology. Stroke is the fifth leading cause of death. Okay, first is heart attack. The incidence of stroke is around 8 lakh people annually. Stroke is the leading cause of disability. Okay, the incidence of stroke has declined, but the morbidity has increased. Means life, the patient is not. Most of the persons are not dying because of stroke because you can go through 20, 25 years ago. Whoever have suffered with stroke, the person will die in 1 year, 2 years. Okay, because of diagnosis purpose. We doesn't have proper diagnosis at that time. Now diagnosis is very easy. You can go to stroke happens, CT, MRI, then directly they will advise IV thrombosis. Okay, the injection which give for anticoagulant effect, then surgery sometimes needed. So it will become very rapidly within 3 to 4 days. Okay, so the patient will become okay, but if they have paralysis, hemiplegia, disability for speech, so these are very long-term diseases which leads sometimes long life, sometimes they will recover. Okay, so this is the thing. So morbidity has increased, mortality decreased, but morbidity lifestyle is decreases due to longer life expectancy. The life risk of stroke is high in women. So here the lifetime risk of stroke is high in women because their life expectancy is more than men. Okay, at least 5 million people die from strokes and millions of others remain disabled. Okay, so this is very, very important. 5 million people mm, die from strokes and millions of people are disabled. They doesn't have, their hand is not working, their leg is not working, unable to speak, unable to listen. Anything will happen. Okay. So what is the pathophysiology? Stroke is a result of ischemia in the area of brain. The sodium, potassium, ATPase pumps fail mainly because of the poor production of adenosine triphosphate and failure of aerobic mechanism. Ischemia leads to depolarization of cell, which results in calcium influx into cell, elevated lactic acid, acetylcholine free radicals, cell death increases glutamate and leads to a cascade of chemicals. So what will happen? There is a loss of main in the ischemic stroke. The proper the circulation of blood is not happening. So that's the reason the cell is not working. So oxygen decreases, blood sugar decreases. Okay, blood cells decreases. So what will happen? It will leads to depolarization. Mean negative. They will go into the negativity. Negative ions are occupied. So the polarization is not happening. So what will happen? The debris will occur. The cell will die gradually. Acidosis will happen. Lactic acid increases. Free radicals are increased. So the cell will die. Okay, so this is the reason behind the pathophysiology. So you have to examine the patient history and physical. You have to take the history, proper history, and symptoms, onsets of symptoms. When was a patient came to your clinic, you have to ask what are the symptoms, what happened. So he will tell, I have upper limb and lower limb weakness since 6 a.m. from 2 days. Okay, so this stroke has happened 2 days ago, and followed by gradually his speech is involved. Gradually his speech is decreases, uh, dysarthria or slurred speech, slurring, unable to speak loudly. All will this you can see the patient. Sometimes they are aphasic, unable to speak anything. Okay, by this physical interaction, you have to ask the patient. The patient, you have to ask level of consciousness. Is this conscious? You have to ask the patient name. He's telling, okay, he's conscious. He is not telling his name, but he is saying with the eyes, naked eyes. Means he is lost his uh, speech. So this is GCS. We will call Glasgow Coma Scale, GCS. Okay. So we'll see the GCS also in the examination. So a language also, fluency, naming, comprehension, repetition, what you have to observe. And dysarthria, the speech motor, have to ask the patient to lift his upper hand, lower hand, upper hand, right hand, left hand, and legs, right leg, left leg, and able to have to tell if he's able to lift the hand, you have to ask the patient to make the how to ask the patient to grip, ask the patient to touch you uh, and give the power. Okay, and you have to ask the patient to lift the hand when you have to when you are uh, trying to pull down him against the gravitational force. So these are the examination. You have to do motor. We will discuss that also. GCS and power, very very important. We will discuss both. And you have to ask that see the visual fields, how is the vision is able to see in all direction, or he see one direction only. Everything, eye movements, facial sides or signs also seen. Is there any facial paralysis also? Ataxia, if his power is okay, then you have to ask the patient to walk, okay, without on the toe, on the heel, with one leg. So if will do, then there is no ataxia. If he doesn't do, there is ataxia. So with proper history and examination, we are able to reach the proper area where the stroke occurs in the brain. This is very important. So here the mostly we have arteries in the brain. We have ACA, anterior cerebellar artery, MCA, mid cerebellar artery, PCA, posterior cerebellar artery. So if the frontal area affected, we'll call ACA territory infarct. A mid cerebellar artery is affected, so mid cerebellar artery territory infarct. PCA, posterior cerebellar artery infarct. So any which artery is affected, the localized brain tissue will damage, and you will get to know the with the symptoms of the patient. Okay. So these are the things you have to remember. So what are the uh, things during, what are the diagnosis? How you diagnose the patient? Here we have the things, evaluation. Okay, evaluation is very important. After that evaluation, you can go to the treatment part. The initial work of a stroke patient involving stabilizing the airway. ABC will call the patient is able to breathing, or their circulation is okay, airway is there. So means that you can go through the investigations and proper things. But airway is not there, breathing is not there. So mostly the patient will go to the ventilator. Okay. So first is CT scan is very important. Head CT. Then sometimes CT angiography. Okay. So because we need to treat the brain very rapidly, then afterwards, if there is no proper sign in the CT, you have to go to the MRI also. Okay. Next is you have to go to blood count, cardiac makers, PT with INR, APTT because of the all the clotting factors you have to know about that liquid lipid profile, or else he have sugar, you have to go to the HbA1c. So let's see the CT, hemorrhagic CT brain hemorrhagic stroke. You can see that this is the hemorrhagic stroke. You can see in the CT, this is the sign of, you can see that this is very large hemorrhage in the frontal area, frontal. Some part of parietal also involved, frontal also involved, temporal also involved. This is very large, so sometimes they need surgery. Patient or what doctor will open this skull area with drill, and they will uh, release all the hematoma. Okay, this is a small bleed you can see in the CT scan. There are all types of bleed in the frontal region. This is a ventricular bleed. You can see that. You can see these are the ventricles in the ventricle, intraventricular bleed with parieto-temporal hemorrhagic stroke. This is only uh, this is right side. Okay, right side, right parietal front temporoparietal bleed, hemorrhagic bleed. This is MRI. In the MRI, the bleed is in black color. Okay, you can see these are the bleeds in the. You can go through that. Next is MRI. We will see the stroke. We will see the infarct in brain. Infarct. Hmm. You can go through it. If the infarct is there, you will see black color in the image. Okay, in the black in the CT, the hemorrhagic stroke is white color. Okay, in the CT, the infarct is in black color. So this is very important. Whenever see the file, you have to see that, or else you have to go through the report. So this is MRI. In the MRI, the brain scan you have to go through that this is the white part, so this is infarct in the MRI. Okay, in the CT the white color is hemorrhage. Okay, this is the differentiation you have to understood. So this is MRI, CT. Okay, you can go through that. Clot or hemorrhage. So here hemorrhage is in black color. So these are the differentiation between MRI, CT. Okay, so these are the lipid things. You are the have to advise this patient while initially, and first CT is very important because we have to not to waste the time of the patient. When you initially do that CT, you will get to know what type of problem is there. So emergency treatment is needed to the patient to protect from death. Okay, so here we stop our topic. We'll talk tomorrow treatment and management, and we have two other topics also. That is very important. GCS, very important. GCS, Glasgow Coma Scale, and power. Tomorrow we'll talk treatment in modern medicine as well as in EH and GCS scale and power of upper limb and lower limb, whatever that. We have treatment part. That's treatment. Other things are there here. We will discuss tomorrow. Okay. If you have any doubt, kindly ask.